Welcome to Diabetes Awareness Program serial videos. I am Dr. N.S. Ramesh, Senior Consultant Diabetologist from Diaplus Diabetes Specialty Center, Basavannagudi, Bangalore. Let us move to episode number 7. Here we will discuss the development of diabetes, that is, defects to result in diabetes, or why and how blood sugars increase, that is the pathophysiology of type 2 diabetes. The first defect is insulin deficiency. Insulin production decreases by the pancreas due to beta cell loss. It is genetically predetermined. Here is the pancreas in the abdomen which produces insulin, and these are the beta cells in a healthy person, and these are the beta cells in a diabetes patient. Observe how they are decreased. Beta cell loss is at the rate of about 4 to 5% every year. By the time diabetes is diagnosed, already there is 50 to 60% loss of insulin. It is due to apoptosis of the beta cells. Apoptosis means programmed beta cell death, leading to increased blood sugar levels. This picture clearly shows how beta cell loss progresses and results in diabetes. A diabetes patient is born with 100% insulin. As he enters into a stage with risk factors, that is obesity, etc., he enters into insulin resistance and hyperinsulinemia, that is insulin demand will be increased to be produced, and as the beta cell, and he enters into stage of beta cell failure, that is beta cell starts losing and insulin production starts decreasing, and insulin production starts decreasing and the blood sugar starts increasing, and the pre-diabetes continues and lasts for about 10 to 12 years, and he enters into stage of diabetes. So by the time diabetes starts, already there is 50 to 60% loss of insulin, and the diabetes stage progresses, and over a period of another 10 to 12 years, there will be no more insulin, or insulin production will be totally absent. So that is why diabetes is a progressive disease. Second defect is insulin resistance. There is a reduced target tissue sensitivity to the effect of insulin, that is, the insulin doesn't work properly. It is called insulin resistance, leading to increased blood sugar levels. The third defect is increased hepatic glucose output, HGO, that is, liver starts producing excess glucose. As there is decreased insulin secreted by the beta cells, insulin loses control over glucagon secreted by the alpha cells. Normally, insulin controls or regulates the glucagon production. Here, glucagon becomes excess due to lack of insulin, and which converts back glycogen to glucose in excess quantities, leading to increased blood glucose levels. The fourth defect is increased renal reabsorption. The kidney absorbs back glucose excessively. Normally, glucose is excreted by the kidneys and reabsorbed back, and in diabetes, reabsorption of glucose will be in excess quantities, leading to increased blood glucose levels. Fifth defect is decreased incretin mechanism. Inefficient intestinal hormones and decreased incretin effect to stimulate insulin release. When we take food, the K and L cells in the intestines are stimulated to produce incretin hormones. These hormones stimulate the beta cells to produce insulin, and this effect this mechanism is blunted in diabetes, leading to increased blood glucose levels. Sixth defect is gluco and lipotoxicity. Glucotoxicity and lipotoxicity toxic to beta cells. Here the excess quantities of glucose and the excess quantities of cholesterols in the circulating blood, they are toxic to beta cells, causing beta cell exhaustion, leading to increase in the blood sugar levels. These are the several defects which cause increase in the blood sugar levels, resulting in type 2 diabetes. Thank you.